This educational video will help patients and caregivers understand and manage eczema. The main goal of eczema care is to maintain healthy skin. Just as you brush your teeth twice a day to maintain good oral health, you also need to take care of your skin every day to keep your eczema under control and to maintain your skin barrier. What is eczema?
Eczema is a chronic inflammatory skin condition characterized by dry plaques that are red and severely itchy. The symptoms can be mild, where the skin looks dry and scaly, or they can be more severe, where the skin becomes red, raised and raw, with oozing, crusting and scaling. And although there is no cure for this skin condition, it can be managed by being consistent and diligent with your daily skin care. Eczema can occur anywhere on the body and is usually found on the flexors, on the back of the arms, back of the knees. There are many types of eczema, but the most common one is atopic dermatitis. Atopic refers to the hereditary tendency towards eczema, asthma and allergies. People with eczema may also suffer from one of these other atopic diseases.
What causes eczema?
The exact cause of eczema is unknown. However, research has shown that there are genetic, immunological, and environmental factors that play a role. Eczema can come and go and can move around the body. Just as one plaque clears up, another one may develop. This is the chronic nature of the disease. The skin is made up of two main layers, the outer layer called the epidermis and the inner layer called the dermis. The epidermis is the skin's barrier. Our skin is the barrier to the outside world. It is somewhat waterproof and keeps our internal organs and systems safe from the elements and from bacteria that may try to invade our bodies. Healthy skin is like bricks and mortar. The skin oils which act like mortar hold together the skin cells which are like the bricks, creating a nice strong barrier. Atopic dermatitis patients, however, have an impaired barrier. That means that their skin barrier is broken down, letting their natural moisture out and allowing irritants and allergens in. This causes their skin to become dry and crack, and when this happens, it is known as an eczema flare-up.
For people with eczema, their oil or mortar is broken down, causing cracks and damage in their skin barrier. Therefore, the goal of eczema management is to get moisture back into the skin and to create a barrier to protect the skin and eventually improve the patient's own skin barrier function. Flare-ups.
Flare-ups can be caused by environmental irritants or triggers, such as certain soaps, laundry detergents, clothing fabrics, deodorants, perfumes, carpet fibers, and dust. Sometimes a flare-up will occur with no recognizable trigger. Overheating, excessive sweating, low humidity, certain foods, anxiety, and stress can also contribute to these flare-ups. When the skin becomes irritated by one of these triggers, it itches, causing the sufferers to scratch the affected area. Scratching makes the condition worse, and the skin becomes inflamed and reddened, further aggravating the itch. This is called the so-called itch-scratch cycle, and it can become so severe, causing tremendous pain. One thing I'd like to emphasize to both adult patients and the parents of children with eczema is that it is most often a chronic condition. There is no magic bullet, no cure. However, you can effectively manage this condition, but it takes daily diligence and continued efforts.
Tips for living with eczema.
In addition to bathing and moisturizing and using your prescription products, there are a few other things that you can do to stay comfortable and effectively manage your eczema throughout the day. As the Executive Director of the Eczema Society of Canada, I also have 2 children who suffer from the condition. To help us manage on a daily basis, I like to keep the following tips in mind. First, there's no quick fix to eczema. It takes long-term management, but if you put in the effort, you should see great results. Keeping your skin moist and well hydrated by bathing and moisturizing daily is your first line of defense. A cool mist humidifier may be helpful, especially in the bedroom. Just ensure that you follow the cleaning instructions that come with the unit. Avoid sweating and overheating when possible, as it will increase the itchiness and contribute to your eczema flares. Try applying an ice pack to the skin during an itchy flare-up, as this will help to ease the itchiness and the discomfort. Be sure to use some type of layer of cotton or a towel between your skin and the ice pack just to protect the skin. Cotton breathable clothing is often most comfortable against the skin. Arm yourself with a good moisturizer and a gentle cleanser. And do apply that moisturizer a few times throughout the day or when you start to feel a little bit itchy. Avoid harsh soaps, detergents, and fragrances, as these may contribute to your eczema flares. Look for sunscreens that are formulated for sensitive skin, and it's often wise to patch test these on a very small area before applying to the entire body. Keep nails filed short and smooth to lessen the damage done by scratching. This is especially important for children because the damage that they do is what contributes to eczema flares and to possibly infection. Use your prescription products exactly as your doctor tells you, and ask questions when you're there if you're unsure or have any concerns about your treatment. Remember that people often use too little of a product rather than too much, and using the product correctly is going to ensure that you get the results you're looking for.